Welcome to the 707, a weekly half-hour program produced by KRCB, a service of NorCal Public Media. The 707 features voices and stories from your community, stories that expose our vulnerabilities, and stories that show how we are connected to each other. I'm your host, Michelle Marques. My guest today is Lisa Carreno, President and CEO of United Way of the Wine Country. She joins me in our new studios in Rohnert Park to talk about the recent stresses to our community's support systems as federal policy and funding have been rapidly changing. I ask her what kind of impact this has had on the services they provide.
Just in terms of food and meals over the last 6 months, what we have seen is like a 300% increase in need across the months since July through October 31st. So we started out, with high engagement because shifting public policy, starting with changes in H.R. 1's passage, began to kind of ignite concern about what would be happening with food benefits and other benefits as well. And what we can see happening through our website's engagement and through our call center's engagement is an ongoing surge in inquiries about food especially, but also Medi-Cal benefits and income and wage assistance and energy assistance and quite frankly, housing needs. Last week I got a call from a woman I could tell was elderly who needed help with her housing because she'd just gotten a 90-day eviction notice. So right now, obviously, we're talking a lot about food and meals because of the disruption in SNAP benefits. But, the top 5 needs across 211's availability continue to be housing, income and financial assistance, medical and mental health care, energy assistance, and also transportation. Folks have a hard time getting to and from wherever they need to go. And now, if they need to get to and from a place to get food, and they're afraid to do that, or they can't do that because they don't have the resources to do that, the good thing is we've just been granted some resources from United Way Worldwide and Lyft to make it possible to connect with transportation support in order to get those resources.
That's wonderful. You just said that people are afraid to go and get food. What do you mean by that?
People are afraid not just to go and get food. They're afraid to go to the drugstore. They're afraid to go to medical appointments. They're afraid to go to a whole host of things that they need to be doing. They're afraid to go to work. And that's because of what's happening with the increase in ICE and immigration enforcement and, the chilling effect of what they're seeing on TV and in other media about what's happening. When somebody's going to the drugstore, as is happening quite a bit in Southern California, to pick up medication and they're being detained and separated from their family, the whole community is affected by that. When they're seeing people dropping off their children at childcare and then being dragged away and detained, it has a chilling effect. So if they're not working, they don't have income. If they don't have income, they can't pay for groceries, they can't pay for rent, they can't pay for gas. So transportation becomes an issue to get to anything that they might need.
So you talked about 211 and that it is a vital resource, sort of a hub for people to use. Right. Tell us about 211. How did it start? What do you do?
Right. So 211 is more than an information and referral line. That's kind of how it's known. It's what it's been known as for the past 20 years. It arrived here in Sonoma County literally 20 years ago on February 11th, 2005. And it was, in fact, that. It was an online and telephone directory to help people get information when they called about where they could get the benefits that we've been talking about. It's grown a lot over 2 decades. And now what it is an online and call center and texting platform that helps people to navigate resources. So we know from a recent study we've just completed that over 141,000 people in our community have reached out through 211 mostly by calling our call center, dialing 211 and talking to a live human being about what their needs are. That navigator is certified and trained and is always being monitored for quality, is reaching into a database that we update regularly with new information about local agencies and their resources. And we're really updating it now because there have been so many changes over recent months. What happens when they call is there's Q&A, there's a triage that's done, and that trained call center specialist who can communicate with them in English and Spanish, they're all bilingual, but also in another 150 languages, can help them through that Q&A ascertain what it is that they really need and then get them connected to those resources. And between the 141,000 who were assisted through the call center, and then there were 1.4 million web searches during that same 6-year period of time that I'm reporting on. What we know is our average client is a 50-year-old woman.
Really?
Who is probably a caregiver to at least one, maybe two younger generations, and also an older generation. 70% of our clients are people who come back to the platform because the information they've gotten in the past is accurate and reliable, but their needs are persistent. They're urgent, and they are chronic. They are not going away. So what we know is that we are providing service and support through 211 Sonoma to the most vulnerable households in our community. And what we also know from a different report, the United Ways of California Real Cost Measure report, is that something on the order of at least 45,000 households in Sonoma County live below the real cost measure for this area. For a family of 4, that's $114,000 in income annually.
Wow.
Even if a family is making the average, which is around $86,000 in income, there's still over $20,000 gap between that income and what the costs of their real needs are.
Right.
So 211 is this navigation, coordination, resource management pipeline that they have access to 24/7. It's secure. It's confidential. They can access it from their mobile devices, from their desktops, and they can come back to it over and over and over again at no cost.
Yeah. And I also like the fact that you're talking to an actual person, because there's so many things that you can suss out. They might call for one particular thing. Say it might be, I lost my CalFresh, or my CalFresh has been halted because of what has happened with the government shutdown. But then when you're talking to a client, you can find out, oh, wait, there's all these other resources or other things that they also could use.
That's exactly right. That Q&A, that rapport that develops over the course of a few minutes of conversation, leads to understanding more of the context of why that person has been pushed to call 211 in the first place. And it is through that trust building, and it's significant, that we get a stronger and stronger sense of just how vulnerable they are. It wouldn't be unusual for us to learn that there are young dependent children at home, that there are maternal child health needs that are unmet or not met as fully as they need to be, that there's a need for income and financial assistance, that there's a need for special education support. All of those resources are available through the 211 database.
Can you tell me about the kinds of services that United Way of Wine Country provides, what your pillars sort of are?
Yeah. So United Way of the Wine Country has 2 community impact initiatives. We've talked quite a bit already about 211 Sonoma. We became the administrator for 211 Sonoma in the summer of 2019. And we are growing and expanding and modernizing the 211 Sonoma platform as we speak. The next generation 211 Sonoma is going to be connected besides being a backbone that connects data to about a dozen or maybe 24 agencies right now that are exchanging information about the same client. That's a closed loop information exchange. Mm-hmm. The ideal is that with our partners, Health Action Together and Sonoma Connect, Sonoma Unidos, the core partners to this partnership and the agencies that we are pulling together, syncing up, will be able to provide wraparound support and a level of follow-up and quality assurance that makes certain that that access gap has been filled and those needs that I mentioned were chronic are being addressed and going away.
The other big community initiative that they handle is a program called Earn It, Keep It, Save It. It provides free tax assistance to low-income residents with support to help invest tax returns and additional wraparound services. Volunteers are being recruited now for the program at unitedwayWineCountry.org. We'll continue our conversation with Lisa Carreno, President and CEO of United Way of the Wine Country, in the next segment of the 707 on KRCB.
I'm Corva Coleman from NPR News with a little something to kickstart your mornings. Sonoma First News is a weekday morning podcast with the top local stories and weather updates from across Sonoma County. From Petaluma to Bodega Bay, Sonoma First News has you covered. Subscribe now through KRCB's website, on the NorCal mobile app, or wherever you get your podcasts. Sonoma First News from Sonoma County's NPR station, KRCB-FM.
Welcome back to the 707 on KRCB. I'm your host, Michelle Marques. I'm talking with Lisa Carreno, President and CEO of United Way of the Wine Country. She says volunteers play a vital role in their organization.
Earlier this year, actually just between May and September, we interviewed through a survey tool at dozens of community-based events, more than 1,000 of our immigrant residents to understand particularly what their needs were or are. We did that in collaboration with County of Sonoma partners and especially with the team at the Sonoma County Secure Families Collaborative. It's so helpful for us to have volunteers from the community, especially who are native speakers of other languages, who can help folks who are filling out the survey on their mobile device to provide that information and connect them to the 211 resources. The number one need immigrants said they articulated is housing, right? The number two need they articulated is belonging. So hearing from them that they want to feel welcome, like they matter, like they're worth our attention and support, that's the number two need. When asked what they want more of, what they want more of is more access to 211, as well as accessible housing, affordable housing, jobs so that they can support their families, pay for that housing and their other needs, and medical care. They're very, very, very concerned about what's going to happen with all these changes in policy and how that's going to affect their physical and mental health.
And that has been really rough. Let's address that, the changes, because it's almost hard to talk about in an interview because things change so
daily,
rapidly, right? I mean, even with the government shutdown, just in the last week, things have gone up and down, and whether the Supreme Court is going to address SNAP and now the Justice Department has removed that, I can't imagine how hard that is then for you to supply accurate information. How do you prepare the people who work at United Way of the Wine Country to talk and give the most accurate information to the public when they reach out?
Right. Well, I mean, my message to our 211 team and also to our free tax assistance team is we're doing the best we can with the resources that we have. So while that may be fluid and change from day to day, we need to be kind and compassionate with ourselves and kind and compassionate with our strategic partners as well, because we're all working right now in uncertainty. So just leaning into collaborating and building trust with one another is as essential as breathing, to tell you the truth, because things will change and we're going to have to adapt, because the resources that we might have had to apply to the situation yesterday might not be there today. We need to be sure that we are finding resources that are available in rural communities and really giving visibility to resources that are in rural communities, especially, that don't land in agencies that have 501c3 status or even fiscal agents. There's a whole network, for example, of food and meal providers who are not connected with the Human Services Directory, to the 211 database, to the directory that our friends at the Redwood Empire Food Bank manage. And that's a massive database.
Yeah.
There are these informal networks that are real. Even if we don't know the answer, we're going to try to find the answer and help them connect with resources that will help them get closer to meeting their needs.
Let's talk more specifically about what is going on with the emergency food situation.
Mm-hmm.
Things in November, our CalFresh benefits were delayed or halted.
Mm-hmm.
So what things are you saying to people who are calling in about food?
We're introducing text food, text comida to the wider community now that it is becoming a part of 211 Sonoma and United Way of the Wine Country. So the way this works is, if you want to find food or meals through texting or through WhatsApp, folks would text the number 707-353-3882. And what they would text to that number is the word food or comida. And once they get started in that texting platform, they're going to text their zip code. And then they're going to text whether they're seeking food or they're seeking meals. And the platform is automatically going to give them hyper-geographic information about the resources that are there. Also, on the 211sonoma.org website, we relaunched the website this week with a spotlight section at the top of that page that has a button that folks can click that says, for food and meal assistance, click here.
Yeah, I actually, from UnitedWayOfWineCountry.org or UnitedWayWineCountry.org, I saw that right at the top banner, clicked on it, and there was a bunch of resources right there.
Oh, fantastic. I'm glad did you click through?
Yeah,
Did you have a good experience with it?
Yeah, it was really great. I mean, it had information about how the CalFresh benefits had been delayed. It talked about what wasn't impacted, which was also important to know, like CalWorks benefits not impacted, the transitional nutrition benefit also not impacted. So like things that as a client, as a customer, I might have, and then question, oh, is this related? Am I going to lose this too?
Right.
Like those were immediately answered. So there was a bunch of information just on that first page that was really helpful.
I'm glad to hear that. So see, Michelle, that actually is an example of why it's so important to lean into the collaboration and building trust among partners. That information came from our friends at the Sonoma County Human Services Department. They're sending information out to their network and asking us to share it. We're taking that information and making it live on our website. You know, every 4 minutes, somebody is reaching out to 211 Sonoma. So not only adding it to the site, but giving it pride of place at the top of the page.
Right.
You will find this information at the top of the page. You'll also find information about services and support for our immigrant residents and services and support for folks who get Medi-Cal. So all of that we're updating it as quickly as we can. Our call center team, which, by the way, is based in Ventura County, Interface Children and Family Services, provides the call center support and the website support. And we did that intentionally because back in 2017, during the Sonoma Complex fires, we had a local-based call center. Everybody was evacuated.
Oh,
and
my
it
gosh.
was, it just...
I didn't even think about that.
It really struggled. The volunteer center at the time was the administrator for 211, and their CEO, Cammie Roberts, and the volunteers from the board of directors and staff were fielding calls because the call center team was evacuated.
Oh my gosh.
So in an effort to provide some emergency preparedness infrastructure, we intentionally have set up this relationship with our 211 call center in Ventura County, and we have an absolutely fabulous collaboration with that team. And so we're working together virtually around the clock to update resources, refresh the website, update the website, and all of the resources in the resource database.
Access resources by calling 211 on your phone or text 211-211. Learn more online at unitedwaywinecountry.org. I'm your host and producer of this program, Michelle Marques. This show is a service of NorCal Public Media. Our president and CEO is Darren Lachelle.